How to survive a stroke when you're alone. Top 5 emergency steps you must know. Imagine this. You're home alone, it's already dark, and your phone is sitting across the room in the living area. Suddenly, one side of your face starts to feel numb. Your left arm becomes noticeably weak. Your speech begins to slur. Your words no longer sound the way they normally do. You know something is wrong, but there's no one there to confirm it. No one to call for help. No one said, "We need to call 911 now." At that moment, it all depends on you and only you. For millions of Americans over 60, this isn't just a scenario to imagine. It's a real and serious risk. Every 40 seconds, someone in the US suffers a stroke. And if they're not treated within the first 60 minutes, the chances of permanent disability or even death rise sharply. But the most frightening part isn't the physical symptom itself. It's how the brain responds to it. A stroke can cause confusion within seconds. And unfortunately, your first instinct is often denial. Maybe I just slept wrong. Probably just tired. I'll wait. It'll pass soon. That inner voice is what slows you down at the very moment you need to act faster than ever. That's why in the next few minutes, I'm going to share with you the 5 most critical survival steps to take when you suspect you're having a stroke and no one is there to help. These steps are simple, easy to remember, and fully doable even as your body begins to weaken. And I want you to pay close attention to step number 4. It's a defensive body position that may go against what you'd expect, but emergency medical experts have confirmed it can help maintain blood flow to the brain, something that may determine whether you survive while waiting for help to arrive. Because in this moment, you're no longer just a patient, you become the detective of your own body. Use the same tools that EMTs and ER professionals rely on, especially the F.A.S.T assessment, to evaluate and respond quickly. No one can save you better than you when you're equipped with the right knowledge. Now, let's begin with the first step. First, check your face. Get to a mirror or turn on your phone's camera. Try to give a big smile. Does one side of your face droop? The mirror won't lie even when your brain wants to. Next, check your arms. Hold both arms straight out in front of you like you're carrying a tray, and hold them there for 5 seconds. If one arm starts to drift downward, that's a major red flag. Then listen to your speech. Say a simple sentence out loud like, "The sky is blue." Are your words slurred? Are you struggling to form the words? This is a direct signal from your brain that something is wrong.
But a stroke can be tricky. Sometimes it doesn't play by the F.A.S.T rules perfectly. Be on high alert for any other sudden changes, like vision problems, a bout of dizziness that throws you off balance, or a severe headache that comes out of nowhere. The T in F.A.S.T stands for time, and it's the most important part. Every second counts. Do not wait. Don't negotiate with the symptoms or hope they'll go away. So that brings us to number 2. Call 911 immediately. Call 911. This isn't the time to call a family member or to wait and see. Your first and only call is to 911. Don't worry if you can't speak clearly. Just say one word: stroke. Dispatchers are trained for these kinds of calls. Their job is to understand what can't be said. Even if you can't get a single word out, stay on the line. They can identify your location. If you can't reach your phone, do not panic. Use your voice. Shout, "Hey Siri, call 911," or "Alexa, call for help." These smart devices aren't toys, they're lifelines. If all you can do is make a sound, bang on the wall or the floor, make noise. When they answer, tell them 3 essential things: I think I'm having a stroke, your location, and whether the door is locked. Letting them know the door is locked saves them precious seconds they would otherwise spend breaking it down. And here's a piece of advice that few people know but could completely change your outcome. Ask to be taken to a designated stroke center. Not all hospitals are equipped equally. Requesting a stroke center is like asking for a cardiologist during a heart attack. It's where the best specialists and technology are, ready to act immediately. Your life is worth it. Number 3, make it easy for the responders to reach you. You've called 911. Help is on the way. The single most important thing you can do now is unlock your front door. Don't make them break it down. Think of that locked door as a wall between you and survival. Take that wall down, but do not push yourself if your body won't let you. Next, turn on all the lights, inside and on the porch. Make your house a beacon. Once you've done those essential tasks, your physical work is over. From this moment on, any exertion is your enemy. Understand that your brain is in crisis, fighting for every bit of blood and oxygen. Any physical effort, even walking across the room, can raise your blood pressure and worsen the damage to your brain. Your only job now is to conserve energy. Lie down where you will be easily seen the moment they walk in. This not only helps them find you faster, it is the most critical step to protect yourself from further injury while you wait.
Number 4, get into a safe position while you wait. How you position your body while waiting for emergency services can make a critical difference. The goal is to minimize complications and prevent further injury. If you're feeling weak or dizzy, which are common stroke symptoms, lie down on your side instead of standing or sitting. This reduces the risk of a fall and additional injury. The recovery position, lying on your side with your top leg bent and your bottom arm supporting your head, is ideal because it helps keep your airway open. Keep your head slightly elevated if you can. A small pillow or cushion can help. This position may reduce pressure in the brain for certain types of strokes. Avoid eating or drinking anything while you wait. A stroke can affect your ability to swallow, creating a choking hazard. Also, some stroke treatments cannot be given if you've recently eaten. Remove any tight clothing, like a restrictive collar or belt, that could interfere with your breathing or circulation. Loosen anything around your neck, chest, or waist. Try to stay warm without overheating. A stroke can affect your body's temperature regulation, and being too cold or too hot can put additional stress on your body. Most importantly, stay as calm as you can. While this is easier said than done, stress and panic can raise your blood pressure and potentially worsen the damage from the stroke. Focus on breathing slowly and steadily while you wait for help to arrive. Before we continue, if you're finding this information helpful, please consider subscribing to our channel for more content like this. Number 5, document your symptoms and how they're progressing. While you're waiting for emergency services, making a note of when your symptoms began and how they are changing can provide invaluable information to the medical providers. The exact time your symptoms started is one of the most critical pieces of information doctors need. Some of the most effective stroke treatments must be administered within a specific window of time from when symptoms first appeared. If you can, write down the precise time you first noticed any symptoms. This information can determine your treatment options. If you are able, use your phone to note the exact time symptoms started, which symptom you experienced first, how the symptoms have progressed or changed, and any actions you took, like taking medication or changing your position. If writing or typing is difficult, consider using your phone's voice recorder to verbally log this information. Beyond just noting the time, pay attention to whether the symptoms are getting worse, staying the same, or, in rare cases, improving. This progression tells doctors a story about what is happening inside your brain. Also make a note if you've taken any medications recently, especially blood thinners, pain relievers, or blood pressure medicine. This information directly impacts treatment decisions at the hospital. If you are able and clear-headed enough, set an alarm on your phone to go off every few minutes. This can help prevent you from losing consciousness without anyone realizing it and acts as a backup in case you were unable to call for help.
The specific details you capture during this emergency can significantly influence your treatment plan once you receive medical care. Surviving a stroke when you're alone doesn't end when the paramedics arrive. What happens at the hospital and in the weeks that follow will define your long-term outcome. Once at the hospital, stroke treatment focuses on restoring blood flow to your brain as quickly as possible. For ischemic strokes, which are caused by a blood clot, treatments may include clot-busting drugs like TPA or a procedure called a mechanical thrombectomy to physically remove the clot. These interventions are most effective when given within a few hours of the first symptom, which is why recognizing the signs and getting help fast is so critical. The recovery process continues long after the initial emergency. Physical therapy, speech therapy, and occupational therapy may be necessary to regain functions affected by the stroke. The brain has remarkable plasticity, and with the right rehabilitation, many stroke survivors regain a significant amount of function. The best way to survive a stroke is to prevent it from happening in the first place. Managing risk factors like high blood pressure, high cholesterol, diabetes, smoking, and excessive alcohol consumption dramatically reduces your risk. Regular health checkups can identify these risk factors before they lead to an emergency. For those at high risk or who live alone, consider putting safeguards in place: a regular check-in system with friends or family, medical alert devices, and smart home technologies that can detect signs of trouble. It's also a good idea to have a stroke risk assessment with your doctor. Time is the single most important factor in stroke survival and recovery. Every preparatory step you take before an emergency and every minute you save during one directly translates into preserved brain function. By knowing how to recognize and respond to a stroke when you're alone, you give yourself the best possible chance not just to survive, but to recover well. To learn more, please watch our other videos on the early warning signs of a stroke and how to prevent them, right here on our channel.